Hello, my name is Salliss and I am going to be talking about responses to injury. So this is assignment 2. Firstly, I just want to say about how there's acute responses and chronic responses. So acute is kind of there and then. The length is very short, so a sprained ankle, for example, won't be as long as a broken leg. So the recovery time is very different, whereas chronic is long-term effects, and how say an ACL would be up to 6 to 9 months of recovery. So that's a very long time compared to acute. There's three stages that you go through, or there's 3 stages that occur when you pick up an injury. So there's loads of injuries that you can pick up, some more serious than others, and some can lead to you being very emotional and just not having you more recovery time for this, or less recovery time, and obviously more time out, and how your body responds and how you mentally respond as well. So if I have a sprained ankle, for example, it's very short time that I'll need to recover, whereas say a torn ligament or something like that is very long, and obviously it's a very winding situation. It's going to take a while to recover. But the 3 stages, so for the first one, it's primary. So when you pick up an injury, in this stage, it'll be about in the first 10 minutes to 7 days, you'll realise these types of symptoms, and it's kind of like the redness. So in the affected area, say for example the leg, it'll be very red. The temperature of the person will be very, very quite high, for the reason that obviously to that affected area there's a lot of pain. So the redness is due to the amount of blood flow going in the body, and obviously the more blood being pushed around the body, the more the temperature of the body increases. Tissue damage, so in that area there's we have tissues that can be they can get torn and stuff like that. So when it comes to tissue damage, that can take quite a bit of recovery, but it's not as visual as you can be. It's a bit harder to just kind of recover from that. General pain, obviously it's going to hurt. It just depends on how much it hurts to the person. So obviously it's going to hurt quite a bit at the start, but it may pan out that it doesn't hurt as much like you realise, because obviously it's the initial shock that makes the person more scared and feeling more pain because of how they're reacting. But depending on the injury, of course, the pain will be more excruciating or less. So inflammation, so you got the inflammation in the area, so like the redness basically, it'll just be like a patch where you can see, and it's just kind of almost fiery because it's just so red, and it's very noticeable. General bleeding, if you've got a cut, or just any form, like even if you hit your head, there'll be it could be blood. Like any area there's going to be blood. So whatever affected area, there could be bleeding. Whether there's a lot of bleeding or not, depending on the wound. Loss of function, so you could feel numbness in that area. It's very where you can't move that limb. So say my leg, for example, I wouldn't be able to move the limb as well. Just feels like a tingling sensation as well. And then finally we've got swelling, which is pretty obvious because it'll be very noticeable, like the redness, but it's just a lump. And obviously with these types of injuries, you need to treat them straight away to reduce swelling, with say a bandage, trying to reduce the injury as quickly as possible, identifying it as quickly as possible. So that's physiological, whereas you've got psychological is a bit different. Obviously, let's go for a sprain, for example. It's very unlikely that that's going to be a long-term thing. Like, it's just a short-term injury. It's not going to take long to recover. But in the moment, I've known, especially with experience, that I've sprained my ankle so bad it feels like I've broken it, and it just turns out it's just a sprain, and it's just recovered quite quickly. But to the athlete, they may think differently to what you can see. So obviously knowing that you can immediately assess what's happened and know that it's a sprain is good, but in the athlete's eyes it may be a lot more serious than you think. So they could be quite scared that obviously it is their ankle that's done, they've bust. So they're going to be out for a little while and won't be able to play. So recovery, obviously, you're going to be, they're just going to be scared. Being scared and just kind of, especially if it's an injury where you don't really know what it is, and to the athlete they may think it's dire, so they're in a bit of shock and despair almost, thinking that maybe they won't recover, or they're just scared of what it could be. But it's all down to this is only a short primary kind of thing. This happens with all of it, like even initially with like even serious injuries, there's swelling, there's bleeding, there's inflammation, there's all this type of stuff. There will be tissue damage in that area, because tissue damage is general, like it's just tearing the muscle almost, and obviously it needs to be filled in and recovered. But that's due down to collagen, I think. But generally, it's just how the way they react initially. This is just the start of it, but the second response to injury is the repair stage. So this will take up, be up to 8 to 20 days, still quite short, but still quite a lengthy process. But during these 8 to 20 days, there'll be an increase in collagen fibers. So it's what kind of surrounds the skin to, help with, just developing the tissues. Formation of scar tissues. So say a cut, for example, usually will turn into a scar, so a visual kind of representation, but that's down to scar tissues just trying to cover the wound, and that's what you see when you have a scar. The inflammation has reduced, so it looks a little less serious than it was, not as red. Also, platelets stick together to cover the wound, so basically the affected area, for example my hand, the platelets all stick together, cover the wound to stop the bleeding and stop it from becoming infected. Collagen fibers surround the wound. As I said, the more collagen fibers increase, and obviously they end up surrounding the wound to help with the process of healing. And also the formation of scar tissues, like I said. And it's just like kind of like, for example, as well, the swelling, it'll reduce, because obviously usually in swelling it's quite instant that you get rid of the swelling, so that's out of the way. But usually with the bleeding, it's just kind of trying to maintain it until the platelets begin to form. And obviously, like with some surgeries and some incidents, like the bleeding will just reoccur occasionally, like it will carry on reoccurring, but that's just where the wounds opened up again. And obviously, if you're not going through the right recovery stages and stuff like that, this will occur. Like if you're not following guidelines, for example, if that wound, you shouldn't be doing more physical exercise, otherwise the wound will open up again, that kind of thing. You're not letting the body repair itself. During this stage, it's quite it's not long, but it's short-ish, so you're going to be quite worried that hopefully it doesn't turn into anything, because obviously when you get back into the game, that's the only thing you're going to be thinking about. And if you will recover to your full potential like you were before, that's the main aim. Obviously, however serious it is the idea. But so you'll be quite, I think you'll be content almost, but very positive. You can be positive because obviously, like, after you know what it is, and especially if it's not as serious, you can be positive that it's going to be an easy recovery. But obviously, if it's quite a serious recovery, depending on how quick the doctors and the medics were quick, to respond, will be the end all and of how you'll recover and if you'll be good. People will obviously be thinking negative as well, demotivation, whether they're actually going to recover, or they'll be motivated enough to think, I'm gonna go out there, I'm gonna be fine. Or like say a doctor, for example, because you could have your club doctor that has an opinion, and the doctors and medics and all those kind of things, they'll have their own opinions, but it's whether you believe the one where they say, you're not going to recover, or the one where they say, yes, you're going to recover, and regardless, you'll be like, no, I'm going to keep fighting and I'm going to recover. So that is usually what the types of emotional, psychological things would be going through their mind. The third one is repair. No, it's not. It's remodeling, sorry. The third one is remodeling. So obviously this is where the body kind of is post-injury, I guess. So you're recovering. Like, this is where you've gotten all the painful stuff out of the way, I guess, and you're going through that recovery stage of going through therapy and all that kind of stuff. But during this phase, this is about like 6 to 9 months, maybe 6 to 7, like, or 17. It could, it depends on how long. So it's like an ACL would be 6 to 9, so it's a long time. But during this phase, you'll feel an increase in the strength. So my leg, for example, or my arm, if that was the affected area, I wouldn't have much sensitivity there. It would be quite weak compared to this arm, which I would be regularly using because I can't have any motion with this arm. So obviously this will be a little bit weaker. Obviously it'll gain its own strength back before you go through recovery and you begin to do like gym sessions and getting the strength up of that affected area. Like I said, sensitivity. So sensitivity is reduced, I guess, because obviously like it'll be very tender, and you'll be if you poke it, it'll be very sensitive to and how your body responds to that touching or something like that. Obviously it'll be reduced because obviously it's getting to its normal state now where it's not hurting as much. Obviously because of the collagen fibres and all that kind of stuff and the scar tissues, your skin will begin to turn to your skin colour. So it'll turn to your skin colour because obviously you're recovering now, and obviously there's no more swelling or inflammation as much. Obviously reduced swelling, like swelling almost pretty much gone. I guess a better organisation of collagen fibres, and I was going to say about collagen fibres because you can find collagen fibres in tendons, bones, ligaments, muscles, just all around the body, and they help with the reproduction of soft tissue cells, I think. But yeah, so they help more with that, and they just realigning all the tendons and stuff like that in the body so that you're prepared for recovery, and just it's just an easier process. Obviously it takes time for collagen fibres to realign and like scar tissue cells, blood clotting, all that kind of stuff. It takes a while because obviously your body's not just going to immediately do it because it's not used to it. But eventually your body's going to start this recovery process, and during this recovery process the athlete will probably be more motivated knowing that there is a time or set date as to when they'll actually be recovered and okay to like play. I think they may be scared as well because obviously once you're post-injury and you've finished the recovery stage and all that kind of stuff, the one thing that's going to be lingering on a player's mind is, I don't want to become injured again, because there's many times where players have become injured immediately again. Obviously, usually it's related to the exact same area where they've gotten injured before. There are a lot of athletes that pick up the exact same injury, but for example, like a knee injury or something, like if someone goes in for a tackle, for example, they're going to be more scared now because obviously they don't want to hurt that area, so they're not going to perform to their peak because they're scared. I think with everybody, say if you got hit in the head with a ball, you're going to be more scared to go in for things and like thinking that you're going to get hit in the face, and that's just down to the fear because you know how much it hurts and how much you have to go through. So maybe a bit of demotivation, very unhappy, scared, but then obviously happy that you're going to be okay. A lot of people aren't grateful enough that after injury they're still okay to play games and like continue their career or even walk. But yeah, that's the remodeling stage. It's very like the last stage, the longest stage. I wanted to talk about the responses a bit more as well, because there's many responses you can have to different types of recovery, and obviously the primary, repair and remodelling. So there's types of reactions such as happy, sad, depressed, reassurance, fear, motivation, lack of motivation, isolation, stuff like that. And you know, when it comes to things like that, you can, you know, with anxiety and stuff like that, it can become more during your daily life, especially after you've recovered. It could be all mental. You can begin to have substance abuse. Yeah, that is usually what it's led to. It's like kind of mental substance abuse, frustration, because of obviously you haven't recovered properly, or you aren't gonna play that sport ever again, or something like that. But yeah, all these things can usually happen because of the type of injuries you picked up and how you recover and how your body responds to it. Another thing as well during the rehabilitation stage would be goal setting. A lot of people do goal setting because it helps them to reach out for something like a goal, for example, you know, like it's in the name, but going out there to achieve something and knowing that, you know, through stages, through day by day, you're going to recover, and then you end up, obviously in the rehabilitation stage, you're doing little things such as to gain strength back in the muscles, doing small reps, and then obviously gaining more, doing loads of reps, and then going for more weight and stuff like that. That's like the goal settings, and then obviously the later you get through the rehabilitation stage, the more you're going to be going for bigger goals, and obviously the end period, that is motivation, I feel, and obviously you've done it and you completed it. But lack of motivation just is always a big one because of just how people give up very easily. I also want to talk about little things such as in injuries. There's loads of things, but like the inflammation and all that kind of stuff is down to like just out of the fact of when blood vessels are damaged, there's no oxygen getting to the affected area, and until those tissues and all that kind of stuff are repaired, not enough oxygen is going to get to that area, which is why obviously the collagen fibres, all that kind of stuff, it all needs to happen quicker, and obviously this is how people react to the injury and what they do. I wanted to talk about certain injuries as well, because you have bone, ligament, muscle, tendons, that kind of thing, and obviously they're all pretty much affected. I feel like with ACLs, I think it's to do with the tendons, and obviously like tissue, you know, tearing and all that kind of ligaments tearing. So obviously when they tear, they're then very hard to either recover or maintain, because obviously like once you've torn it, usually you can't put it back together. But there's other things such as like say your bones. Obviously we're focusing on the muscles, say like an inflammation for example, and all that kind of stuff. On the outside of the skin, obviously it's happening on the inside with the blood flow, but on the outside of the skin, and obviously with a bone break, the bone could obviously snaps, and it could result in the bone penetrating the skin from the inside, and obviously that, you know, that's how that happens. So there's many bone related injuries. Obviously with a dislocation as well, is to do with the bone. When the bone dislocates, say like your shoulder, the ball and socket will come out, and then you need to have someone to put it back in. It's very quick. You can put a dislocation back in depending on where it is very quickly, and then obviously you go for a tiny recovery stage, but usually your arms and calves, so it could be a little bit longer, but there's different types of injuries, and obviously all of them have different times and dates and pain, and how you psychologically react to them. I'm going to assess two different injuries, a concussion and a sprain. So I haven't got anybody to work on, but for the sprain, for example, I'm going to do the soul tap method, which is basically where it's a series of different things. So I'll look at my patient as the club doctor or something. I'll see that my the athlete has fallen over and a little bit of impact has occurred on their ankle or just in general. So what the saw tap thing is going to do is it's going to assess whereabouts the injury is and whereabouts it hurts and to what level of pain and thing that the athlete will be going through. So I'll see my athlete, I'll go over to them and I'll be like, hello, my name's Harry. Just trying to just talk, just communication, because communication is very key. I'm gonna just lightly touch. Well, first I'm gonna have a look at the accident, the incident. I'm gonna have a look to see if there's anything that is, obvious, such as bleeding or something, or inflammation or something like that. I'm going to also assess the area to make sure that there's no additional factors that could cause more injury. After that, I'm going to, just touch around just to see, ask where it's hurting. So obviously, will it hurt? And they'll say yeah or no or whatever. And then next, I'm just gonna ask them whereabouts does it hurt. All that kind of stuff. I'm gonna further assess by just elevating the leg a bit and just checking the foot. So obviously, I guess after I've identified where the area is, I can assess that it's a sprain. And so I'll elevate it. I'll just feel around a little bit more, and then I'm gonna ask her if they can move it. So if they can move their foot, then that's fine. It's not as serious, but if they can't, then obviously that it's quite a serious level of how sprained it is. Next, I'm then just going to apply pressure, and just to see if it hurts or if they can put any strength into it. The next one's the concussion, and I believe it's called the standardized assessment of concussion, the SAC basically. And what it is just assessing the person and then asking them a couple questions to see where they are, mentally and obviously I guess physically as well, to see how serious of a concussion it is, if it is. So I'd go up to my patient and I'd ask them, I'd first assess whereabouts on their head it's hurting. I'd ask them how they are feeling, and I'd just talk to them generally. Just kind of just seeing where it's at, making sure there's no other dangers that could cause further concussion. Then basically the next thing is it's a list of questions. So I'd ask them such as things like just to see where their head's at, and just be like, where are you right now? And if they can give me the right answer, what's the score? Who just scored? What time is it? Do you know who you are? That kind of thing, because obviously a concussion can be very serious into the respects of losing your memory and losing train of thought. So obviously they could be very lost. So that's how that would work, and that's how you would assess those injuries, because these are the ways to do it. And then obviously once we know what it is, we can, or the medics and the doctors can effectively get them off the field and into some really good care, and obviously making sure that the injury doesn't become worse.